It's 11 a.m. in Seoul. I'm Kim Mo-gyan at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation in English. Director of Health Policy Yoon Tae-ho will be briefing us on the coronavirus situation here in South Korea. He will fill us in on the number of new infection cases and what kind of efforts the government is making to contain the virus, especially with the spread of cluster infection cases seen in recent days. Now, as we wait for the briefing, let me give you a brief summary of the current developments. South Korea reported 195 new COVID-19 cases on Thursday, and 3 additional deaths have been reported. Let's look at the scene right now.
Let us now begin our regular briefing for the September 3rd Thursday. As of today midnight, we have 188 new local infections. Yesterday, we had 3 additional fatalities, with the death toll now standing at 329. I extend my deepest condolences to the deceased and the members of the bereaved families. The number of new local infections, it has dropped to the 100s for the first time since 2 weeks or so. And we believe that this was effective thanks to the participation by the public in social distancing and quarantine measures. And we would like to thank you once again for your participation. However, in the metropolitan area, we still have concentrated numbers of 148 cases today, and this is continuing for the past several days. And also, we have cluster infections in other non-metropolitan areas. And we are seeing cluster infections at multiple venues, at churches and offices, as well as apartment complexes as well. And therefore, we cannot let our guards down as of yet. Through an intensified quarantine measures for a week, we believe that we need to decrease the number of on-day increase of the cases and to recover our capacity to control the virus and to restore our medical capacity as well. Today marks the 5th day of intensified quarantine measures in the metropolitan area. During the past weekend, we identified and analyzed the mobile traffic, and for the next 2 weeks, we have seen about a 25% decrease in the amount of mobile traffic. We would like to thank the proactive participation from the metropolitan area's residents, and we believe that if we minimize our physical contact, we believe that we will have a continued trend of downward trend of our new cases. Above all, it is very important for individuals to regard themselves as proactive agents of quarantine, and please note that this is the most effective method in containing the virus now. And the government will also exert our full efforts and muster our strength to combat the virus. All of the regional public servants are mobilized to also look at the quarantine measures. And yesterday, at the Pan government meeting, we carried out 214 investigations of these multi-use facilities, as well as 61 churches, and we identified 8 cases of breaches of quarantine measures. And we carried out an investigation for about 60,000 venues in the areas of 39 categories. And we also found out the breaches of wearing a face mask and so forth. And we will also facilitate the use of flexible working hours for the public institutions as well. And the Ministry of Public Personnel, we will also decrease the number of congestion for commute hours. And with the intensified quarantine measures put in place in August, all of the public institutions in the Seoul metropolitan region are also utilizing flexible working hours and work from home scheme for about 1/3 of its employees. And we ask the private companies to actively participate in such a scheme. We are also exerting our full efforts to enable a stable treatment for the patients. And we have increased and secured 320 more hospital beds for the infectious disease designated hospitals, and we will also secure more of 77 additional beds. And during this month, we will also secure 110 more hospital beds for those who are critically ill. And moreover, the Defense Ministry is also designating 8 hospital beds inside its own medical facility to be used as hospital beds to treat the severely ill patients. And the military doctors will also be mobilized to 9 life treatment centers to provide support. And we will also provide our great support, and the Ministry of Defense has also provided great support for many areas going forward. And right now, we have about 13 life treatment centers, which is housing about 3,200 people. And we will also secure additional thousands of the rooms going forward. And we believe that the rest of this week is a make or break moment to determine the fate of our outbreak going forward. And many of the self-employed are experiencing great losses and damages. And despite their difficulties, we are carrying out intensified quarantine measures. However, we ask the residents in the metropolitan area to stay home as much as possible and refrain from making non-essential outings. It is very important that we minimize our physical gatherings and physical contacts, and please cancel all of your social gatherings, events, or travel. We are witnessing a spread in the COVID-19 virus at any place, whether they be churches, office buildings, and so forth. Please note that a moment of complacency can hinder us from returning back to our daily normal lives. With a prolonged social distancing, we believe that many people are experiencing fatigue, and there have been also many cases of hindering of the quarantine measures put in place by the quarantine authorities. And we believe that the public is also very worried about the continued walkout by the medical practitioners. The government would like to apologize you for that. However, please note that there are hidden heroes within our society that are exerting their full efforts and sacrificing to make the best out of our quarantine measures. There are many residents of the metropolitan area that are refraining from going outside and staying at home. And there are many people, many nurses, many doctors, and many people in the medical sector that are battling against the COVID-19. And please note their dedication and sacrifice as well. And please never forget there are hidden heroes within our society. If you remember these people, and please do not lose hope, and please have a glimmer of hope, and we shall focus on our efforts to fight the COVID-19. And please remember the power and the energy of the public to be able to combat the COVID-19 virus, and the government will also exert our full efforts. And as for the trainee doctors who are defying the medical duties, we are seeing great medical disruptions nationwide. And the government, the National Assembly, as well as the senior doctors are providing great alternatives and chances and opportunities for you to return to your duties, and please return to your duties as soon as possible. We have a few words for the medical school students who are facing scheduled national qualification exam. And this has been delayed by a week. And we ask for your rational decision, and we hope and we believe that many people can participate in this examination. And we ask for the deans of the medical school students also to participate in such measure. Thank you very much.
질의응답 시간을 가지겠습니다. 배석자분들은 단상 위로 올라와 주시기 바랍니다.
Now that was the daily briefing on the coronavirus situation here in South Korea. We just heard that there were 195 additional infection cases of COVID-19, bringing the total to 20,644. There were 3 additional deaths, and the death toll stands at 329. That wraps up our coverage of this morning's briefing. We'll be back with our regular newscast at 12 p.m. Korea time. Bye for now.